1 in 8 men will develop prostate cancer during his lifetime. It is the second leading cause of cancer death in men. Its silent and insidious progression is responsible for this high mortality rate. The early symptoms of prostate cancer are often vague, making it difficult to detect the problem. The absence of obvious symptoms and the tendency to ignore subtle symptoms often lead to a delay in diagnosis. When prostate cancer is detected at an advanced stage, treatment options are often reduced, and the chances of cure are lower. Despite these challenges, there is a glimmer of hope. Prostate cancer is one of the few cancers for which early detection and prompt action can significantly improve outcomes. This fact underscores the importance of early detection and rapid intervention. 9 out of 10 men who recognize symptoms at an early stage and seek prompt treatment manage to overcome the disease. Early-stage prostate cancer can progress slowly and thus be easier to treat. Early detection increases men's chances of receiving less invasive and more effective treatments, such as surgery or radiotherapy. It increases the chances not only of survival, but also of prospering after treatment. It is a small gland, the size of a walnut, that plays an essential role in the male reproductive system. The gland produces semen, the fluid used to transport sperm during ejaculation. The cancerous growth of prostate cells is caused by genetic mutations. It is important to distinguish between prostate cancer and benign prostatic hyperplasia, BPH, which is a non-cancerous growth of the prostate. Benign prostatic hyperplasia occurs more frequently in older men. Both conditions can cause similar symptoms, such as difficulty urinating. However, unlike prostate carcinoma, BPH generally does not pose a threat to life. The exact cause of prostate carcinoma remains elusive despite the growing understanding of this disease. Age, family history, and lifestyle are all risk factors. Men over 50 are at higher risk. Those with a family history of prostate carcinoma are also more susceptible to the disease. Other factors such as obesity and lack of exercise, excessive consumption of dairy products and ultra-processed foods, and exposure to environmental toxins such as tobacco smoke, industrial chemicals, and air pollution are also linked to a higher risk of prostate cancer. In its early stages, prostate cancer can develop slowly but may go undetected due to the absence of obvious symptoms. Many men with prostate carcinoma may not show any symptoms until the disease is advanced. This is why it is important for men to get screened regularly and to be vigilant about any changes they notice in their health. Early tumors develop slowly and are unlikely to cause discomfort until they become large enough to spread to other organs or affect surrounding tissues. Early detection is essential for improving the prognosis. Recognizing the early warning signs can help you receive timely treatment, which will increase your chances of cure. Although prostate cancer is not the only disease that can cause these symptoms, it is important never to ignore them. The most common early warning sign is frequent urination. This phenomenon, known as nocturia, occurs more often at night. Healthy men urinate between 6 and 8 times a day and no more than once at night. Prostate enlargement can increase the frequency of urination. It is often accompanied by a sense of urgency and an inability to completely empty the bladder. This can lead to a feeling of incomplete bladder emptying and may even be accompanied by urinary incontinence, the involuntary loss of urine. Back pain can also be a symptom of the spread of prostate cancer to the bones, particularly the spine. The pain may worsen at night and not respond to painkillers. This pain is described as persistent, deep, and debilitating, which differentiates it from typical muscle tension or arthritis. Back pain may be the first symptom that men notice, leading them to consult a doctor and eventually obtain a diagnosis. As the cancer progresses, it can invade the spinal cord or the nerves that originate from it. This causes numbness, weakness, or tingling in the legs or feet. The cancer can cause these symptoms when it compresses the nerves that control the movements and sensations of the lower limbs. This can lead to difficulties in walking or even partial or total paralysis. It is important to remember that not all back and nerve pain symptoms are related to prostate cancer. Similar symptoms can be caused by conditions such as arthritis or herniated discs. If these symptoms appear suddenly or worsen, it is advisable to consult a doctor immediately. The presence of blood in the urine or semen can be a warning sign. The presence of blood in the urine or semen can be due to benign conditions such as kidney stones or a urinary tract infection, but it can also indicate prostate cancer. The presence of blood in the urine or semen, even in small amounts, should not be ignored. It requires professional evaluation to rule out cancer and other serious conditions. Among the other symptoms of advanced prostate cancer are fatigue, weight loss, and pain during ejaculation or urination. These symptoms may indicate that the cancer has spread to another part of the body, such as the lymph nodes or bones. When the cancer invades nearby tissues and organs, it can cause significant discomfort. The body's fight against the cancer can lead to fatigue and weight loss. The disease depletes the body of its energy and nutrients. These symptoms are distressing, but they also highlight the importance of consulting a doctor as soon as any abnormality is noticed, no matter how minor it may seem at first. These symptoms can be concerning, but they are not specific to prostate cancer. Some of these symptoms, such as frequent urination and back pain, are due to less serious conditions. If any of these symptoms worsen or persist, you should consult a doctor immediately for an evaluation. Prostate cancer can be treated, especially if detected early. Therapeutic options depend on the stage, the patient's overall health, and the rate of cancer growth. Treatment options for localized prostate carcinoma may include active surveillance, radiotherapy, or surgery. Prostatectomy is a surgical procedure that involves removing the prostate. It can be effective in treating cancers that have not spread. Radiotherapy can be used to destroy cancer cells using high-energy beams. It is effective in both localized and advanced stages. Active surveillance involves closely monitoring the cancer without immediate treatment. It is generally recommended for slow-growing cancers that do not cause symptoms. In cases of more advanced prostate cancer, when the cancer has spread to other parts of the body and is more severe, aggressive treatments such as hormone therapy or chemotherapy may be necessary. Chemotherapy uses powerful drugs that kill cancer cells throughout the body. Hormone therapy reduces testosterone levels, a hormone responsible for the growth of prostate tumor cells. Both treatments can have side effects such as fatigue, nausea, and hair loss. However, they are effective in managing the disease and prolonging life. Lifestyle changes, in addition to medical treatment, can be an important factor in maintaining prostate health. A healthy diet, regular physical exercise, and abstaining from tobacco and alcohol can reduce the risk of developing prostate cancer. For men at high risk, including those with a family history of prostate cancer or other risk factors, regular screenings through PSA testing and digital rectal exams are essential for early detection. The landscape of prostate cancer diagnosis is evolving as medical research and technology continue to advance. In recent years, the development of precise diagnostic tools such as multiparametric MRIs and genetic tests has enabled earlier and more accurate diagnosis of prostate cancer. These tools not only allow for earlier detection, but also provide detailed information about the characteristics of the tumor, such as its aggressiveness or likelihood of spreading. This information is essential for tailoring the best treatment plan for each patient and ultimately improving their chances of success. The advent of targeted therapy and immunotherapy has also brought hope to patients with advanced prostate carcinoma. Immunotherapy stimulates the immune system to destroy cancer cells, while targeted therapy attacks the genetic and molecular abnormalities driving cancer growth. Clinical trials are being conducted to test these treatments. They have shown promising results in improving survival rates in patients with metastatic or advanced prostate cancer. These treatments, when more widely available, could change the way prostate cancer is treated, offering patients more options and better long-term survival chances. Moreover, prostate cancer researchers are not just looking for new treatments. They also aim to improve patients' quality of life. Some prostate cancer treatments, particularly those involving surgery or radiotherapy, can have significant side effects. These include sexual dysfunction, incontinence, and intestinal problems. Researchers are trying to find ways to reduce these side effects, improve recovery time, and ensure that patients maintain a high quality of life during treatment. Robotic-assisted surgeries, for example, have enabled more precise and less invasive surgery, resulting in shorter hospital stays and faster recovery. Counseling and support groups have become essential in the treatment of prostate cancer. Cancer can be a difficult diagnosis to cope with emotionally and psychologically. It is important for patients facing it to receive professional support. Many cancer centers and hospitals offer support groups and resources to help men deal with prostate cancer, from diagnosis to treatment. These support systems provide not only emotional relief but also practical advice on managing side effects, changing lifestyles, and maintaining a positive attitude. Men must continue to play an active role in their own health. Even though the medical community has made significant progress in treating prostate cancer, early detection and regular screenings are the best ways to detect prostate cancer when it is still treatable. Men over 50 and those with a family history of prostate cancer should regularly discuss the risks and benefits of screening with their healthcare providers. Early detection, treatment, and support are essential for managing prostate cancer. It is also important to continue educating and raising awareness about prostate cancer. Many men are unaware of the symptoms, risk factors, and the importance of early detection. Public health campaigns and educational materials are essential to ensure that men understand the importance of prostate health and the measures they can take to reduce risks. It is important to encourage open discussions about prostate cancer, both within the medical community and the general public, to reduce the stigma associated with the disease. This will also encourage men to seek help when they need it. A healthy lifestyle not only helps reduce the risk of prostate cancer but also improves overall health and manages side effects. It is important for healthcare systems to adapt to the increasing number of men diagnosed with prostate carcinoma each year and to continue providing them with the best possible care. Each patient's treatment should be tailored to their specific situation, such as their age, health status, and stage of the disease. Clinical research is essential to predict which patients will benefit most from specific treatments. This allows for the development of more effective and personalized therapies. The future of prostate cancer treatment is indeed more promising than ever, thanks to the constant progress in medical research, technology, and treatment methods. A significant shift towards early detection, personalized treatments, and precision medicine is transforming the way prostate cancer is diagnosed and managed.